Okay, thank you.
So, and I'm going to take this opportunity just to explain a little bit further how we came about the Childhood Begins at Home campaign. So in 2014 and 2015, the Home Visiting Subcommittee, which was part of Early Learning PA, began to think that we could work on the Pennsylvania budget by adding a line item specifically for evidence-based home visiting programs that weren't previously covered under other line items in the budget. And so we started writing something called a program revision request. And basically it's a document explaining why we needed to have additional funding for these evidence-based programs. And through that, we then formed more of a joint advocacy campaign where at that time, 4 of the evidence-based programs worked together on some basic advocacy in Harrisburg and working to educate our legislators about the need for more home visiting. And then our Childhood Begins at Home, our official name now, campaign really launched in 2018. And some of you may have participated in some of the events that we had across the state to launch that, including having roundtable discussions with legislators, as well as having our report released, the Childhood Begins at Home report released in 2018 that further describes the critical need for home visiting services for all eligible families in Pennsylvania. Next slide, please.
Sure.
So with all of that, we'd just like to take a minute to really celebrate our accomplishments since 2015 in having an additional $15 million increase in investment in home visiting by Pennsylvania. And in 2018 budget has an additional $4 million to support target expansion of evidence-based home visiting in areas hit hardest by the opioid epidemic in particular, with a focus on families with parents with opioid use disorder. This funding will serve an approximately 1,000 families around Pennsylvania, and many of you on this call may have been recipients of those grants. In addition, since 2015, the 2018-2019 appropriations was one of the largest that we've had in since we began these efforts, which was $5.5 million. Next slide, please. So we'd just like now to just explain that our current Childhood Begins at Home evidence-based programs have expanded, which is great news for Pennsylvania. And so we have Early Head Start, which enhances the ability of low-income families to meet the development and early learning needs of children at home. We have Healthy Families America, which strengthens families by promoting positive parenting, enhancing child and health development, and preventing child abuse and neglect. We have Nurse Family Partnership, which pairs first-time low-income pregnant women with nurses to improve pregnancy, birth outcomes, child health and development, and family economic self-sufficiency. We have Parents as Teachers, which builds the capacity of parents to care for their children while promoting school readiness and healthy child development. And then we also have Family Checkup, which is one of the newest recipients in the grant, which recently added and supports strategies to better engage parents and parent-centered interventions for reducing problem behaviors in children from toddlers through adolescence. In addition, we are supported by our other partners, such as Fight Crime and Invest in Kids, Maternity Care Coalition, Pennsylvania Head Start Association, and the Pennsylvania Parents as Teachers and Pennsylvania Partnership for Children and Trying Together. Next slide, please. So at this time, we would just like to share a special video presented by Secretary Miller.
I'm sorry, trying to figure out how to get the volume. Can you hear it on your end at all?
I cannot hear the video. I'm not sure if anybody in the chat room can respond, that would be helpful.
No, but it is captioned.
Nope, I can't hear that.
I'm sorry. I'm sorry for the technical.
Well, we knew it could be tricky, so maybe we'll just play it because it is captioned, and then hopefully in the recording we can.
I'm so sorry. I don't know why we're having technical difficulties with this. When we send out the recording to the community, we'll send this out as well. We're just going to move on since it's not functioning properly.
Sure. And I just want to talk about Secretary Teresa Miller has been a great supporter of home visiting. And, we're really grateful for that support. She has a quote, as we all think that parenting should be instinctual and that we all naturally have the tools we need to raise a child. But parenting is a tough job and kids don't come with a manual. Early childhood and prenatal home visiting programs provide families with the support and services they need to bond and understand their child as they grow and monitor progress in meeting developmental milestones. Having the support from somebody in the governor's administration is just really critical for us in advancing the home visiting message. So we appreciate that support. And should we just let it play till the end then?
I'll send it out. Let's just continue.
Okay. So as I mentioned earlier, as part of our Childhood Begins at Home campaign, last year we released the Pennsylvania report, which highlighted some critical aspects of evidence-based home visiting programs in Pennsylvania and the increasing need. So for example, in preventing child abuse and neglect, only 21% of Pennsylvania children under the age of 6 known to the child welfare system receive the appropriate evidence-based home visiting services to reduce the likelihood of future childhood abuse and neglect. And in addition, only 4% of the children received, who would be eligible, received the services that could help reduce poverty. Only half of the Pennsylvania children receive services that improve literacy, and only 1 in 10 of the Pennsylvania children received appropriate services to improve their health. As we continue this year, we'll be updating our report, and we hope that you'll keep an eye out, and we'll talk a little bit about more how you can access those resources. So the 2019 campaign is, we have been fortunate enough now, as we're continuing to grow, to go into 2 parts of our membership. So we have expanded to a governing body of members, which include the original organizations, as well as adding membership to the state-based organizations able to take an active role in advocacy. The endorsing members include state-based organizations able to provide support for campaign principles and goals and strategies, as well as individual program sites across the state that are unique. And I just want to take a minute to recognize some of those new endorsing members. So we have Family First Health, Mabel Morris Family Home Visiting Program, Maternal Family and Health Services, National Nurse-Led Care Consortium at PHMC affiliate, the PA chapter of American Academy of Pediatrics, PA Family Support Alliance, Parent-Child Home Program, the People's Emergency Center, the Philadelphia Nurse Family Partnership, the Prevent Child Abuse PA, the Foundation for Delaware County, and the UPMC Home Care Management Services. And we thank all of our endorsing and governing members for all of their hard work this year. And on the next slide, you'll see the listing of all of our governing committee, which has expanded to include programs and critical advocacy partners across the state that are working hard to ensure the importance of evidence-based home visiting is conveyed to the community and policymakers. And as I mentioned earlier, these are many of the organizations have been with us from the beginning, and we've been happy to add some new support from other organizations such as the Allies for Children and Allegheny Family Support. Okay, next slide, please. So the 2019 campaign goals are very ambitious and very exciting. We have, we're going to try to expand the state investment to $25 million in the community-based family centers line within the Department of Human Services budget to serve an additional 5,000 families, which would be an incredible goal. We also are trying to preserve current funding levels in the Nurse Family Partnership line and in the community-based family centers line within the Department of Human Services budget. All of this is really to build upon the Commonwealth's investment in evidence-based home visiting throughout the last few years, as we mentioned earlier, the $15 million that we have been able to achieve. So this would be a significant increase, and this really requires all of us to really give increased efforts in advocacy around evidence-based home visiting. And to speak to that, I'm going to introduce Karen, who will continue to explain how you can be involved.
Great. Well, thank you very much, Rose. Great information for us. And we do want to engage all of you as investors in this campaign. Many people ask if they're allowed to talk about their work and especially are they allowed to talk to legislators or other people who would make decisions about financial investments and other investments in evidence-based home visiting. And yes, there are some distinctions, and you definitely should check with your organization about its policies. But I'll say that lobbying is your attempts to influence a legislator to vote for a specific piece of legislation. And for the most part, you have to be a registered lobbyist to do that. Many nonprofit organizations, local organizations are not registered or do not have registered lobbyists. Some do, but you need to check with your organization about that. More likely, what you can do is advocate. And advocacy is really a broad array of activities that build awareness about evidence-based home visiting, allow you to express your support, your passion for home visiting, and why you support it. You're allowed to talk about evidence-based home visiting in general terms, that it provides parents with educational supports and resources so they can make their family strong. You can describe the impact, what does help make families strong. You can talk about it in terms of a policy issue. Evidence-based home visiting is part of the early care and education constellation of services. Collectively, our community needs to invest in these services to support family health, safety, and prepare children for school entrance, prepare families for school entrance for that matter. So you can see that there are many things that fall under the umbrella of advocacy that are not lobbying, that you, for the most part, you may take part in. Do check with your organization about their policies before embarking on any campaigns of your own. Next, I want to share with you some opportunities to share your voice or use your voice in coordination with your model state office or lead agency. We're going to talk about 5 different ideas related to visits, helping families tell their stories, what kinds of communication strategies you might use, how you might cultivate some community partnerships, and then endorse the campaign. You can work collectively and cooperatively with each other, with other models within your community as well. Again, our message is to build on the Commonwealth's recently expanded state investments in evidence-based home visiting by allocating 25 million more to evidence-based home visiting and to serve a greater proportion of pregnant women, young children, and families. Let's look at champion and legislator visits. So again, working with the evidence-based models, as a campaign, we're trying to coordinate visits with legislators both in their home offices and in Harrisburg. One of the things we've learned in the last 3 years is how impressed legislators are with the fact that we work together, that Nurse Family Partnership and Parents as Teachers, Healthy Families America, Early Head Start, and now Family Checkup are singing the same song. We have the same message. We're supporting the increases in evidence-based home visiting, and it has really helped to build bipartisan support within the legislature for our efforts. So working together is important. Please respond when your evidence-based home visiting model or lead agency calls upon you. You might be hosting an event in your community for champions, for people who are supporting evidence-based home visiting and legislators. You might be visiting with legislators in Harrisburg. The main ideas is that you'll be sharing some information about the model, about evidence-based home visiting, and sharing a short story about family impact. One of the ways that we've seen this work best is where a staff person talks about what the model is or what evidence-based home visiting is, and a family shares a short story. Let's talk a little bit about some of the communication strategies we can use. So many of us are using email blasts, social media, newsletters, all kinds of way of talking about our work in our communities. And so something you can do is add something about the Childhood Begins at Home campaign and help promote evidence-based home visiting. One thing we're looking for some support right now is around creating some mini videos to tell a story that can be posted on social media. And many of you will be receiving requests to create short, very short, 30-second messages from both staff and from parents about the impact of evidence-based home visiting. We encourage you to write letters or to respond to op-eds that have been posted in newsletters or other publications that describe the value of evidence-based home visiting. The op-ed might talk about it more globally, and you could respond with, and here's how it works in our community, and share the message about the impact that, the positive impact that families have experienced through the evidence-based home visiting models that you offer. And also to encourage your partners to endorse the campaign. You have partners in the community that refer families to you, that you refer families to, that are part of your interagency councils or other local collaboratives. Please encourage them to support this campaign. Let's see.
I did just want to add really quick, Karen, that there are 2 other strategies that they can use. And Carolyn, our communications director, is here to touch base on them briefly.
Hi, just real quick to follow up on that. It would be really great if folks could, like our Facebook page for the campaign. You just go to Facebook, punch in Childhood Begins at Home. That will be the page. We'll be ramping up efforts, posting a lot of interesting things that you can use through your work and your networking. So that would be great. So Childhood Begins at Home, look for us on Facebook. And if you or your organization are on Twitter, the campaign handle is at childbegin_home. So that's at childbegin_home. And you could also just go to Twitter and type in Childhood Begins at Home, and you would find our Twitter feed there. Thank you.
Thanks. That's very helpful. One other thing is that we do find in our experience in talking with legislators and talking with even local champions, people who might make support our programs in our communities, is that they do appreciate hearing from families, knowing that we want to be very respectful of families' privacy, and yet knowing that their stories can be very impactful. We want to help support families to speak for themselves. And so we encourage you to encourage families to share their stories. They don't have to tell all, but we do want to ask that they share the impact of evidence-based home visiting in their lives. We encourage you to help them by providing guidance and preparation support. Help them tell a clear, concise message, so that it's short and yet impactful. We want to support also in terms of providing guidance about what to expect in different settings. You may be meeting with a legislator one-on-one in your community, in your office. You may be meeting with a legislator in his or her office in Harrisburg. You might be at a hearing where people are asked to talk about the impact of evidence-based home visiting and parents are sharing stories. It might take place in a roundtable discussion where a couple of us models get together and we're talking with a larger community, and we're asking parents to say something about the impact of evidence-based home visiting. We want to be sure that parents feel comfortable in any of those settings. And I know for me, in learning how to do these things myself, it was helpful to know what to expect. And then I think the last thing is really to be there to support the family. We don't have to speak for families. Certainly they can speak for themselves. But to be there just sitting side by side or standing side by side. And again, helping to respect the boundaries of their family life is really important. And these are things that probably come pretty naturally to most of the evidence-based home visiting practitioners out there. Let's look at also, I mentioned earlier that you're probably part of interagency councils and that you work with other organizations in your community. And so cultivating community champions is really important. Connect with influential leaders in your community. They might be involved in your home visiting program already. Help them understand that we want to work with multiple models when they exist in a community, that we want to support the idea of evidence-based home visiting, that we are a part of the early care and education community, that we help families support and themselves and provide safe, healthy environments for their children. Certainly we want to meet with legislators and their staff regularly. And in fact, we often meet more often with legislative staff than we do directly with the legislator. These people are important, and it's really important to keep legislators and their staff and our local champions involved year-round. We don't want to just go with one ask every spring. In fact, we want to help encourage their involvement in our programs throughout the year. And we can invite them to participate in all kinds of events. We can stay connected through our newsletters, announcements, and social media postings. We can send them little notes to say thanks throughout the year as well, or wanted to let you know that XYZ is happening. So cultivating our community champions is very important. Let me move on to something specific about endorsing the campaign. We mentioned this is a page from the Childhood Begins at Home website, and this is how your champion organizations could sign up to give evidence that they support evidence-based home visiting. And the website itself is really exciting. And so I want to turn to Sarah to share the website and let you know about some of the resources that are there.
Okay, so I'm back on. This is the Childhood Begins at Home website. For those who have never been there before, it's just childhoodbegins@home.org. There is
Sarah, you may need to share your screen because we're still seeing the PowerPoint presentation.
Is that better?
Excellent.
Okay, thank you. I wouldn't have noticed that. So this is the Child Who Begins at Home website. There are several different ways that you can join. Again, there's the overview that we went over. There's a copy of the report down here in the bottom right-hand column that we referenced several times. You can download it for your reference, or you can contact me here at PPC, and I can make sure you get reports if you need them or want to distribute them. There is a join us to sign up to join the campaign, or you can also go through the tab. I do want to note that this section, we are not to the point in this campaign where we need for people to sign up as individuals, that this endorsing support is specifically for organizations. So if your organization has not supported yet, you're able to sign up through here as an organization. I do know that our governing members that are representing each of the evidence-based home visiting models will be reaching out to those individual organizations as well. So if you have any questions about that, please don't hesitate to reach out. There'll be contact information at the end of the webinar for each of the representing models for who you can reach out to determine how your organization can best fit within the campaign. But we just wanted to show you the website for those that have not been there yet.
Great, thanks.
Yes.
I think we wanted to ourselves make the case at this point as the Childhood Begins at Home campaign. Certainly it's about increasing an investment in evidence-based home visiting. It's increasing the numbers of dollars that the state will spend. But you know what? It's really about the why. Why are we encouraging your investment, your time, your energy? Why are we helping to support you in this work? And why are we asking for a larger investment of state dollars? Because we really feel that evidence-based home visiting supports families. One of the things I think that Secretary Miller has said publicly is, children don't come with instructions, and we all need help sometimes. And evidence-based home visiting is something that really can support families at times when they feel the most vulnerable, welcoming a new child into their family. We are encouraging your investment in this campaign so that families can experience the support that families such as these that you can see on the screen have expressed. We all do need help sometimes. We all can help each other sometimes. And evidence-based home visiting is an important investment, an important strategy, an important support, an important service to have available in our communities for families in order to help families, help parents, help grandparents create safe, healthy environments for their children.
And this is Sarah from PPC. I do just want to add that Rosemary touched in the beginning about our large wins for home visiting. So that $5.5 million that we were able to have delegated through appropriations last year. But just to give context, so the total support for home visiting prior to the last 4 years was $28 million. So to increase that by $15 million over the since 2015 is extremely significant. We also know there's a lot of momentum right now. There's momentum from the governor's office. Home visiting is very much on the governor's radar. It has extremely high bipartisan support from both sides of the aisle here in Harrisburg. So we really think now is the time to capitalize on the momentum that we do have from last year. As you heard, we did ask the governor's office, the proposal was $25 million increase for home visiting programs. His budget address will be on February 5th, and we are hoping that he proposes something close to that. We will be reaching out to organizations after that to make sure that we are able to be a collective voice for home visiting programs, for all evidence-based home visiting programs in Pennsylvania. The campaign will be working hard to win dollars. And we can't do it without the voices of the families, without the voices of the actual home visitors in the homes. So please be looking out for those calls to action after he makes his address in February. But I did want to follow up with that we have a long way to go. There's an extreme amount of kids. There's a lot of capacity that are not receiving home visiting services. They don't have the capacity to, they don't know about them. We know the impact the prevention strategies through home visiting programs is, it's just wonderful. So we need to make sure that we are making sure that we're getting out there and doing the best that we can to get public investment into these high quality early childhood home visiting programs. So thank you. Is there anything else you wanted to add, Rosemary or Karen, on that before we move forward?
This is Rosemary, and I just wanted to reiterate and thank PA Partnership for Children for all their leadership with this campaign as well. And, you know, really critical points that were brought up throughout today's session. You know, it's really a team effort, and we have to work, all of us together, to really help make sure that our families are getting their needed services. And as we go through this campaign, we're really looking forward to partnering with as many of you as possible. And it's the local stories, it's the you know, the information that we get from you about the successes that you're having that really empower us and empower legislators to feel that this is something that they should be funding. So continue the good work and help us keep you know, the momentum going.
This is Karen, and I echo both Sarah and Rose's comments. Encourage you to reach out to your governing board representative if you're a part of an evidence-based home visiting program. We're eager to work together among the models and with you in your local communities. Thank you.
And at this time, there were not any questions in the group chat, but if there are any questions from the group, please feel free to either put them in the chat or hopefully we can do it organized in an organized fashion. You can unmute to ask a question at this point. We did list the name of the evidence-based programs that are currently represented on our governing board, who their representation for state contact is, as well as their email contact. And I do want to reinforce that this video was recording today. It will be available on the Childhood Begins at Home website following the presentation as soon as we're able to get it on. But if you have any additional questions about the campaign, how you can support, or what the individual models are doing to participate, these would be the names of the governing board representation that you can reach out to. Do we have any questions? No? Okay, thank you for your participation today. We really appreciate you. Oh, hang on. Is there something I can do to ensure that NFP is properly referenced in public facing materials? That is something I'll get back to privately. Okay, thank you for reaching out to us today. I really appreciate your participation on the call. Thank you to Rosemary and Karen for all of your expertise and your participation in the governing committee for the Childhood Begins at Home campaign. And we look forward to reaching out to everybody after February. Thank you.